concerning our access to vaccines has hitherto been somewhat limited, because it has focused quite narrowly on issues of procurement and what the government did or should have done. And then I saw this article written by Zane, Dangor, and Professor Zuka, which addressed a broader set of issues concerning trade rules, particularly those concerning intellectual property rights, which have a strong bearing on our ability and the ability of other countries similarly situated to address their needs in this pandemic, and also for future pandemics. In their book entitled Fair Trade for All, published in 2005, Stiglitz and Charlton, entitled Fair Trade for All, say the following: international rules for intellectual property rights have potentially huge public health effects and global distributional consequences. As a country that has faced the HIV pandemic for some time, we're not unfamiliar with these questions. I suppose the issue today is whether we want to discuss today is whether the existing trade rules concerning the protection of intellectual property rights, together with, in some combination with national laws, provide us with sufficient flexibility to address our access to vaccines in the context of this COVID-19 pandemic and for future pandemics, or whether some more fundamental regime, revision of the trade regime with respect to international intellectual property rights is required. So I'm looking forward to our conversation today. Let me introduce our three panelists. Zane Dangor, who's a special advisor to our Minister of International Relations and Cooperation, Naledi Pandor. Fatima Hassan, founder and head of the Health Justice Initiative, who's been active on these matters for some time and well known for her work. And then Franziska Zuka, who's an associate professor in the law school and a highly regarded colleague. The format, I'm going to ask each of the panelists, starting with Zane, to speak for about 10 minutes. So that will consume about 30 minutes. And we will then go on to questions and discussion. Please keep your audio and video muted while the panelists address the issues that are under discussion today. So let me ask Zane to unmute, make yourself visible. Hi, Zane. Welcome.
Hi. Welcome. Thank you, Feroz.
Can hear you now.
Can I start?
Yes, please go ahead.
Sure. Thank you, Feroz, and good afternoon to everybody that has joined us. So as you said, we'll be sharing the inputs. I'll speak a bit on the, just the politics of vaccine nationalism. Franziska would then speak more on the waiver in more detail, and Fatima would do that as well, but also to focus on what are the options in terms of the South African government in the absence of a successful waiver. But obviously, at times we will be, emphasizing different elements. So just to start off with vaccine nationalism, because this is something that has come into the public domain, and some have said this is a left-wing concept, and I'll point out in a few minutes' time that it's not. But just to define it, I think vaccine nationalism essentially describes a situation where governments, some governments, sign agreements with pharmaceutical companies to supply their own populations ahead of the vaccines becoming available for others, but also in doing it in a manner that crowds out supplies to other countries. So vaccine nationalism is the opposite of a solidarity approach. At the outset of the COVID pandemic, the WHO, the UN, and indeed leaders of countries across the world called for solidarity and cooperation on measures to stem the virus. We even had a resolution at the GA calling for solidarity in the early stages of the pandemic, with all countries participating. Yet, while committing to work with UN-led initiatives such as COVAX and working in a solidarity-based manner, solidarity issues were emphasized because it was seen as being equitable and science-led, not just about being charitable. The richer countries of the globe actively undermined these processes. So at the same time as scientists started working on vaccines, many of the rich countries bought up vast quantities of the vaccines. They were hedging their bets at that time, as there was not yet enough evidence as to which of these vaccines would be effective. So they pre-ordered most of the stocks of all the leading candidates. So by late last year, or 2020, the net result of all of this is that 14% of the world's population had essentially pre-ordered 53% of the available vaccines at that stage, outside of those produced by Russia and China. And obviously this situation has alarmed the UN Secretary General, who's spoken about vaccine nationalism as being a barrier to defeating COVID-19. And he stressed that this could only be done through international cooperation. Similarly, the WHO has also stated, and the Director General of the WHO has stated that inoculating all the people in a few countries while the vast majority of the world's population remain vulnerable would do very little to stem the pandemic. So they emphasized again that the key to ending a global pandemic is to inoculate a critical mass of people around the globe, more or less simultaneously, in a manner that will break the chain of transmission. So a strategy that seeks to inoculate all people in some countries while leaving the vast majority of the world's population without access to the vaccine just means that the pandemic will continue to be a global challenge. And this was again emphasized by the WHO yesterday. For those who take a more business perspective, in May 2020, the Harvard Business Review described vaccine nationalism as morally reprehensible, but of course, given their background, also outlined the economic hazards. The Harvard Business Review stated that if countries with large numbers of cases lag in obtaining the vaccines and medicines, the disease will continue to disrupt global supply chains, and as a result, national economies will continue to suffer, and the global economy will continue to stagnate. So they were talking about this, we talk about the existential crisis to people. They were talking about the existential crisis for the global economy as well. So, for that reason, the UN Secretary General and the WHO have reiterated calls for more money to be made available for the UN-led initiatives, mainly COVAX. So, just going back, COVAX sought to pool purchasing of viable vaccines as they became available, and then to distribute the vaccines based on ethical considerations to break the chain of viral transmission. So there was with respect to purchasing, which you mentioned earlier, there would have been elements of redress with pooled funds from many of the self-financing countries, cross-subsidizing countries without the necessary resources. Again, here the problem is that much of the richer countries were not committed to such an arrangement. And COVAX did not prevent bilateral deals. Again, to underscore, the net result of all of this is that vaccine supplies have been pre-bought through bilateral deals to the extent that only 20%, and we're hoping this would be improved due to the public pressure, would be available to poorer countries through this facility. So there's agreement that vaccinating all people in some countries and depriving the majority of the world's population from access to the vaccines will not effectively break the virus, the transmission chain of the virus. The health, social, and economic challenges of the pandemic will therefore continue unabated. We've seen that earlier in the debate, that when South Africa or others talked about vaccine nationalism, it was the issues that were raised was failure to purchase on time. What we're also seeing more recently is that the bogeyman of purchasing on time it has been exposed, that key issues is the capabilities to manufacture that's vested with very, very few companies located in a few countries. So, we had warned for some time that the differential pace at which vaccines are rolled out within the context of vaccine nationalism may create conditions for increased political turmoil and tensions in regions of the world. Now, we've seen this turmoil recently in Europe, when it became clear that despite pre-purchasing large volumes of the vaccine, the key issue is manufacturing capabilities by the few who holds the right to manufacture. So we've seen the EU threatening to implement a ban on exports of vaccines produced in the EU, including a ban to the UK. This prompted Sir Jeremy Farrar, who's the scientific advisor to the UK government, warning against the dangers of, yes, vaccine nationalism. So a vaccine strategy that is truly global in nature and monitored through member states is what is required. This is because the pandemic is existential in nature for people and the economies, and cannot be left primarily to the private sector. Therefore, wresting control over vaccines from the private sector, and in particularly from the intellectual property regime associated with the pharmaceutical companies, is critical to meeting our global vaccination targets. It is in this context that South Africa and India, with the support of over 100 WTO members, requested for a general waiver on the agreements on trade-related aspects of intellectual property rights, primarily to ensure that timely, affordable, and equitable access to vaccines, diagnostics, and therapeutics are ramped up so that as many countries and people can access these. At this point, I'm going to conclude, but also point out that the waiver, which Fran will expand on, and Fatima, isn't only about vaccines. It's also about therapeutics. It's about medication to save lives. And it's, we shouldn't just focus solely on the vaccine issues. I'll come back a bit later, Firoz, on some of the international legal dynamics that could come into play. But that would be done after Fran and Fatima's inputs. Thank you.
Thanks, Zane. So you'll come in after Fatima and Fran, right?
Yeah.
Okay. Fatima?
Hi, everyone. I think Franziska is next.
Oh, okay.
But I don't mind which way. I really don't mind.
I thought you guys had sorted.
Yes, okay.
Yeah.
So according to what we discussed, I was next. That's correct.
Okay.
So let me just then continue or follow up on Zane. So surprisingly now trade is discussed again and again when it comes to public health, which you know, it's not as obvious for many as it is for those who work in trade, because it's always about trade and issues, trade and public health, trade and environment. So for us, it's not new. But coming to the waiver and what is that all about? So TRIPS is an agreement within the WTO, one of the WTO agreements that regulates trade-related aspects of intellectual property law, of intellectual property rights to be precise. And what it does is it stipulates what each country or each member state has to do at the national level. So that's a minimum requirement agreement. So it says South Africa has to grant 20 years of patent right protection as an example. Can do more, but it has to do at least that. So that's what TRIPS does, and therefore prevents, of course, the use of patents without getting a license. It does, though, allow to issue compulsory licenses in an emergency situation. So it does provide for that in Article 31. Which is, but on compulsory licensing, I refer to Fatima then for later. So the fact that it does provide for compulsory license caused the question of why do we then need a waiver? That's the main criticism. So scholars, or specifically Western countries, argue that the existing TRIPS flexibilities are actually enough for each country to issue a compulsory license and then to produce themselves generics. We call them generics, or that's how they are known, right? So this is the debate, and it's a huge dispute. The countries that argue usually for the flexibilities being enough or sufficient in the current situation are typically Western countries, those countries that have already purchased the many amounts that Zane referred to, despite the purchase agreements at the moment not even be fulfilled. So what indicates that there are even for them not sufficient amounts on vaccines available. But yeah, this is the general argument. And if you look into it deeper, it also goes along the old lines when it came to generally essential medicines, so access to essential medicines that was previously HIV, malaria medicines. It was always said that it prevents innovation if one takes away the IP rights and does not allow anymore to recoup research and development costs, which here in this instance does not hold at all when one takes into account that we have 210 vaccines in development and research. So there's many innovation going on, and research and developing costs due to the purchase agreements and public funding I would also think is not really a strong argument. However, so South Africa and India now try to push for this waiver, and which I agree for, because they say it's not sufficient. The current flexibilities for compulsory licensing in TRIPS is not sufficient. Why? So what would a waiver do? It would basically allow countries to not grant IP rights at a national level. In other words, if a patented vaccine also enters the country, they wouldn't have to give them 20 years or apply any of the TRIPS provisions. And that waiver would obviously only apply for the duration of the pandemic. So that's what the waiver would do, suspend the TRIPS obligations. Why would that help? So what would it make better than a compulsory license per se, right? So I have now just 4 main points because we wanted to rather have a discussion on it, very short. The first point is a compulsory license requires individual action of country, whilst if you are not restricted to TRIPS provisions, you could actually collaborate across countries, and taking into account the limited capacities, manufacturing capacities, but also resources, specifically amongst developing countries, what Zane already indicated, such collaborative action across countries for manufacturing is strongly required, but the TRIPS agreement would not allow for that due to the individual action required. That's the first main point. So sharing of capacity is prevented. The second point I would like to make is, what about countries without manufacturing capacity? They might not be able to source cheaper generics from countries who are in the position to produce generics due to compulsory license. Why not? The TRIPS requires a compulsory license to only be used within a domestic country, within the domestic sphere. So just if South Africa would produce it, they can only use it for the South African market. There are exceptions to that. Least developed countries would be exempt from that. But what is with other countries? What is with other developing countries who would not have the manufacturing capacity or not enough manufacturing capacity? That can also be. South Africa could easily be in that situation as well. They could not simply import generics where it's produced cheaper, right? Though there is an amendment in 2017 in place that would exempt that. In other words, that says if a country doesn't have manufacturing capacity, it could source that under a long list of requirements. This amendment that entered into force in 2017 is not ratified by all member states, and most prominently not by the UK and the US, who produce one of the major vaccines. So therefore, it would not apply to them, right? Number 3 is, number 3 and 4 are quite short. The TRIPS compulsory license system does not cover very important parts, such as trade secrets, know-how, or cell lines that are important to actually copy vaccine processes. And the fourth, what is usually mentioned actually at first, is the time-consuming process and the cumbersome process of a compulsory license system. You have to negotiate with right holders. It's not really clear who determines what adequate remuneration is. And there are lots of, these are long litigation processes, right? So these are the 4 main points what a waiver would actually contribute. And the most important part is to collaboration amongst countries. As a final point, I would just like to highlight that the waiver would actually also be better for the pharmaceutical companies, because they don't like to have a compulsory license issued on their product for obvious reasons. And in a waiver, they could be part of it and it may potentially influence the actual conditions to what a waiver would be adopted. They could basically influence some requirements, So being part of that negotiation would contribute as well. I now stop here. Hope I was short enough, and would just hand over to Fatima. Thank you.
Great, thanks, Ran. Fatima?
Thank you. Hi, everyone. So I'm just going to reflect on some of the input from Zane and Franziska, and I hope you can hear me and see me. So I think the first issue that we need to note is that we are in a crisis, and we're definitely on the road to disaster. Because if you can't get enough supplies of vaccines, both to South Africa and to all countries in the global south, and particularly in Africa, then we're not going to be able to achieve the objective of global population immunity by the end of 2021. And recent reports indicate that we're looking at even beyond 2023, which means that we with this pandemic for a much longer period than we thought we would, including with multiple waves and multiple lockdowns. And the worrying thing is that in recent weeks, we've discovered variants, not just in South Africa, but in the UK, in Brazil, in other parts of the world as well. And so the longer it takes to immunize everybody in the world, the more variants and mutations you're going to have. And so the issue of urgent access to vaccines is not just about affordability or about trade relations or about diplomatic pressure. It really is a difference between life and death for many of us here in the global south. So let's just do a bit of a situational analysis of how we got to this point. The first is that the WHO only declared a public health emergency of international concern, which is what we call the declaration, early last year. So we're almost a year into that declaration. So, haven't even passed the 12-month line. But during that time, Franziska has mentioned there's been over 200 different potential vaccine candidates. A handful went into phase 3 human trials towards the middle of last year. And now we have a few, what we call front-runner vaccine candidates. That means they are vaccines that actually work. They're actually effective. So that means right now we have the knowledge to actually save a lot of people. We didn't think that would happen within that space of time. The research was accelerated through public investment, public funding, and a lot of public support from various governments, including the US government, through the National Institute for Health, including through the UK government, the EU, and a lot of support from public and government scientists and experts who work in different public institutions across the world, as well as public institutions that were already researching some of these different technologies, who were in the HIV/AIDS field and in the Ebola field. So it's not like all of a sudden new innovation just happened on their own. This was a deliberate strategy. In the US, it was called Operation Warp Speed. In other parts of the world, it was different strategies. And as you know, in South Africa, we also participated in 4 clinical trials, all 4 of which are now potentially front-runner vaccine candidates as well. So in a way, we also contributed to the global body of scientific knowledge. The problem that we're facing, as you must have seen in the last few weeks, particularly in South Africa, is that even though there was a commitment to solidarity, even though in a global pandemic, it's considered a crisis, even though people are calling for the vaccine in particular to be treated as a public good, what we've actually seen in this pandemic, like we saw with HIV/AIDS, is a total deference to pharmaceutical power and interest, and obviously to all of their patent claims, even in situations where the technology was developed with the support and public funding of other governments and other institutions. And secondly, a refusal to explicitly cooperate to scale up manufacturing, and I'll come to that just now. And that links to the TRIPS waiver, as well as to some other initiatives like COVAX and the AU AVAT that I'll discuss now. So what Zane referred to in relation to what happened last year already, which we warned our government about, so nobody can pretend that they didn't know that this was happening, was that while, and this is really the unprecedented part, is that while the pandemic was unfolding and while the research was being carried out, and we still didn't have the data, a number of these governments basically hedged their bets and decided to engage in bilaterals where they committed to what we called AMCs, advanced market commitments. But they committed to multiple AMCs. So they approached multiple pharmaceutical companies and they said to them, if your vaccine works, and if your vaccine is the front-runner vaccine and gets emergency or other use authorization, then we want 200 million dosages or 500 million dosages first, and we are first in line. And so the EU, the UK government, the US, Canada, Australia, Israel, for example, all signed these AMCs by already September and October of last year, and groups such as Oxfam and Human Rights Watch had already then been warning that a few countries in the world with a lesser amount of the world's population had bought up most of the supplies. And that's when we already saw what was going to emerge as a very pernicious form of vaccine nationalism. Currently, where we are in February 2021 is we don't just have the first wave of vaccine nationalism in terms of supplies that have already been committed to the richer nations, which is why we are struggling to find sufficient supplies rapidly for the global south, where in some cases we may only get 35% vaccination coverage by the end of this year, and we still have to wait another 2 years to get full vaccination coverage or widespread vaccination programs to achieve immunity, is that we're now also seeing a form of supply nationalism. So last week, when the EU realized that they're facing quite severe supply shortages of particular vaccines, they decided to take certain measures, and they've taken 2 measures. The one is that they've imposed this really bizarre export ban, and they're saying that any vaccines now made in the EU for the next 2 months at least will be prevented from being exported to any other parts of the world with limited exemptions. And South Africa is actually included in the ban. We're hoping that they'll reverse that. In India, for example, there was a temporary ban. We think that our president actually appealed to the Prime Minister in India to reverse that ban, which is the only reason we're now able to actually access the serum manufactured version of the AstraZeneca vaccine for our healthcare workers in South Africa. So what we had then, or what we're now dealing with, is the number of advanced market commitments, a number of bilateral agreements that have been signed by many of the richer nations, and now also including South Africa, Uganda, and other parts of the global south. In parallel to that, we have this mechanism called COVAX, which we have basically said is actually failing the global south because it can't bring in sufficient supplies, because it still relies on the voluntary cooperation of a number of these pharmaceutical companies. Not all of them are in the mechanism. And COVAX also asks you, for example, to self-finance if it regards you as a middle-income country. So the barriers to enter and access supplies from the COVAX mechanism, which was meant to address global equity, particularly in the global south, is not based on your epidemiological need or based on your public health need or your country with a high COVID burden. No, it's based on some economic classification system which says that high and middle income countries must self-finance and pay different prices for the vaccines that you acquire from there. And then low income countries will be funded directly through donations. So until they're able to get all the money into COVAX, through direct contributions or through philanthropic support, they're not able to assist all of the low-income countries, and also they need supplies while governments have obviously signed their own bilateral agreements. So there's a pecking order about where do the supplies go to first. Because of the bilateral agreement that was signed by the richer nations and the inherent limitations within COVAX, the African Union decided to set up what's called AVAT. So we now have a third mechanism by which many countries in Africa are going to be able to access some supplies. And AVAT is the African Vaccine Acquisition Task Team. And as you've seen, the president has now mentioned it quite a few times, and various corporate players are putting money into it. And they've managed to get 1 billion dosages, according to the president. We're not sure when they'll come. We're not sure where it's from, of which 700 million will come from COVAX and 300 they've managed to find themselves. So within all these different mechanisms, the issues that we're dealing with, which is why the TRIPS waiver, or dealing with the issues of state licensing or fixing our patent laws, or hauling all of these pharmaceutical companies around the table and really kind of being very firm about what's the non-negotiable, is that there's very little tech transfer. Last week, we saw that when the EU was faced with major supply problems and a crisis and shortage, they actually took on AstraZeneca. And last week, 2 new companies were actually given licenses, what we call sub-licenses, to make some of those vaccines. So now Novartis and Sanofi are actually going to be making vaccines for the EU. That was not the case up until the EU had their own supply problems. And I've obviously talked about serum, where AstraZeneca has sub-licensed them. The second issue, of course, is I've talked about the different mechanisms. Everybody's charging a different price. Today, we found out that Uganda is even paying more than what we are paying in South Africa for Serum's version of the AstraZeneca vaccine. There's no price transparency whatsoever. In addition to that, we're now finding out that a number of these drug companies, and remember that not a single one of these have actually been registered for use in South Africa, except for the Serum Section 21 authorization for the vaccines that just came in for our healthcare workers. Johnson & Johnson, Pfizer, AstraZeneca, all of them have their dossiers with SAHPRA, the regulator, but they have not yet been approved for clinical use, and that's important. And we suspect that Sputnik, the Russian vaccine, will now submit its data to the regulator because early data has come out on that. And I don't know, we keep hearing different stories from Moderna, but potentially they may actually sub-license somebody else to submit their dossier. So we could be using a basket of 5 or 6 different vaccines, but that all remains to be seen in the next few months. So within each of these agreements, we're being told that the drug companies are asking for indemnity clauses where they want nation states, and including the South African government, to indemnify them against any claims were there to be any issues with the use of their particular vaccines, which is just the most unbelievable thing in the middle of a pandemic, but could hold up then the conclusion of agreements, the finalization of a price, and then obviously the delivery of supplies to your country. So what we're being told is that they won't release dosages. If they do have some of them, they won't release it until the indemnity is actually signed. And then I think we're having also the issue of market segmentation, which is deliberate. So if you had the TRIPS waiver, if you had the ability of nation states to actually assert more state authority, then you wouldn't have the drug companies deciding who gets a license, where, for which market, for what supplies. And I think the Serum example with AstraZeneca and Oxford University is a perfect example for people to study and look at as to how AstraZeneca decided to segment the global market basically into 2, where they would supply the richer nations, and then Serum must deal with the middle income countries and low income countries with very little price transparency. And so then you even have further supply blockages because you can't just go to any particular company. You can only go to Serum because that is the sub-licensee that AstraZeneca chose, not necessarily the WHO or multiple governments. So let me just go to some of the issues around the TRIPS waiver. Yesterday was a day of action. I'm sure you saw in the media, activists went to all the embassies that are actually blocking the waiver. And I think the irony is that the countries that are blocking the waiver are the very countries that signed advanced market commitments, have bilaterals, and have sufficient supplies to vaccinate their populations, in some cases multiple times over. These countries are blocking the waiver, yet they've already started their vaccination program. So there's a lot of pressure around trying to expose the double standards of these companies. But more difficult than I think the different governments is that the pharmaceutical industry globally has actually said they don't believe that the waiver will actually serve any purpose. And the myth that is being perpetuated is that this is only about vaccines, which Zane talked about. It's not. That it's unlimited. It's not. It's temporary. It's for a limited period until global population immunity is achieved, and it's only for COVID-19 related technologies, diagnostics included, and therapeutics, which includes vaccines. But more importantly, the argument is that, well, even if you gave you the waiver, there's no manufacturing capacity. And in some cases, that's correct, because there's certain technologies, different types of technologies for the different vaccines we're using, which is why I explained to you, the different stages of regulatory approval. But particularly with the mRNA type vaccine, and that's the Moderna one, for example, the experts that we've spoken to have indicated that with a little bit of investment in manufacturing support and scale up and that kind of technological capacity, you could actually scale up that particular type of vaccine technology much faster than the other. So there is a way in which you can do this. I think even if you had to invest in that capacity and wait for, you know, a bit, it would still be faster than waiting for 2023, 2024 for the normal system to work and for the status quo to work. And in other parts of the world, there is existing limited capacity to actually start manufacturing, which is how the AU already found companies last week when it had its own supply shortages. So I think this argument that nobody in the global south can manufacture anything and it will take very long and that current capacity doesn't exist needs to be interrogated a bit more closely. But similarly, I think it's not just about the richer nations and the pharmaceutical companies' conduct. Our government also is culpable. It has sat too long on the Patent Amendments Act. That piece of legislation has now been sitting in Parliament in the middle of a pandemic for months, and nobody in Parliament has actually done anything material to elevate that and to pass that in a pandemic. Our concern, obviously, is that if you don't pass it in COVID, during this time, you're probably never going to. And then when you do want to pass it, you're going to have so much pushback from the industry or from people who believe in, you know, what they call the free market, that it will never get through our parliament. And I mean, Zane and Franziska have talked about state measures that you can use under the current laws, under our own constitution, under the Investment Act, under the very limited, but still it is there, the Patents Act. But that's, you know, easier said than done, and that's why the waiver is important, because when countries have tried to do this before, the usual response is we get put on a trade watch list, and so trade, you know, becomes the important variable, yeah, and diplomatic relations then become more important than actually saving people's lives, because the minute somebody puts a poor country or a country like South Africa onto a trade watch list, the reaction of those governments is then to withdraw. And the idea behind the developing countries' request for a waiver was that, well, then we won't have to have this diplomatic war and we won't have to engage in a trade fight, because we would be given the space in the room to do what's necessary to save lives. So linked to that, and Firoz, that this will be my last point, is that we've written this last weekend because there's interesting developments in the US with the new Biden administration. So the People's Vaccine Campaign wrote on the weekend to the Biden administration, to Tony Fauci, saying that actually you are the co-owner, you are the co-developer of a number of these vaccines that we are now going to have to rely on here in South Africa and the global south. And you need to use your power. It's not new power. You're actually the co-owner. You've passed the law around using the Defense Act in the US for domestic scale-up of capacity and production to benefit the US population. Now you need to do that for the rest of the world. So there is some movement around governments accepting and understanding that we're in such a massive global health crisis. You have to try and vaccinate everybody really fast. Because no one is safe until everyone is safe. It really is genuinely, that is the situation, that they need to be able to march in and say to these companies, you've got to explicitly cooperate, and in the absence of explicit cooperation, these are the state actions that we are going to take. And that's why I want to end off by something which I find quite intriguing. On the one hand, our government has been pushing for a TRIPS waiver since July of last year, and then officially from October of last year, and supported by India and other developing nations. But here in South Africa, the president did not talk about it up until last week. There's not a single briefing on the TRIPS waiver in South Africa. Most people didn't even know that we were pursuing a TRIPS waiver. On top of that, our DDG for Health is acting like we have no power in the way in which these bilateral negotiations are happening with these companies, claiming that they are NDAs, claiming that we can't do anything about prices, claiming that we have no option but to indemnify the companies. So there's a disjuncture. And then, of course, if you go to Parliament, there's just sort of, you know, nobody's really moving the Patent Amendments Act to the fore. And so here's the irony. The EFF, as an opposition party, just recently said that, yes, the vaccine should be declared a public good, but none of the other opposition parties have made public their position on patent monopolies in a pandemic or the role of intellectual property in creating barriers. So we all, you know, there's this expectation that government must find vaccines from the sky or from heaven or somewhere, but we mustn't address the systemic IP issues. So for me, that's quite intriguing that that kind of discussion is not happening in South Africa as yet, whereas that conversation is happening elsewhere. Thank you.
Thanks, Fatima. That was great. Zane?
Afros, I think Fatima and Fran basically covered all the issues that I would have wanted to come back to. We've also got international legal instruments such as the International Covenant on Economic, Social, and Cultural Rights, which has measures that compels all states to ensure that health, and including medicines, is allocated along lines which are non-discriminatory. And South Africa is a signatory to that. And we may want to bring that into the discussion as well, because most countries in the world are signatories to those kind of instruments. And it means that we need to challenge the fact that arguably the manner in which the distribution of vaccines and other health-saving medication and commodities are being distributed may contravene these based on issues of origin, race. And we need to bring that into the discussion as well, because in terms of our constitution, we are, as a government, compelled to ensure that we do not allow for, we challenge instances where breaches of international law in relation to the right to health is obvious in the kind of vaccine nationalism that we see. I think I would think that there's issues around that we can take up on discussion. I just want to say lastly that Fatima's point around the Patents Amendment Act is very critical. That the sooner we table that in Parliament, the better, because it makes our patent laws fully compliant with the flexibilities that arises out of the Doha waiver. And that will allow us to get the kind of emergency measures without unnecessary recourse to the courts or patent commissions. And the sooner we do that, the better. And we are in discussion with DTI, who may do that sooner rather than later. Yeah.
Thanks, Zane. Let me kick off with a question to all of you, just really for clarification. You're all making the case for a waiver, which applies for the duration of the pandemic. I assume that that's for a mix of maybe pragmatic reasons, but also because you have the view that the TRIPS agreements as amended with those flexibilities that you refer to are adequate to address our future challenges. Would that be a correct characterization of what you're arguing? Or, I mean, is there a case for a more fundamental rethink on some of these questions? Anyone?
Yeah, not sure who you want to go first.
Fatima, I can see you, so.
Yeah, I mean, I think it does mean that the way in which the industry and richer nations are responding to the waiver really has to make us course correct to think about why do we have to rely on a trade body to get us out of a global health pandemic. So there is an impatience growing with the WTO and its member states that if you cannot do this in a pandemic that we have never experienced in 100 years, where there is the vaccine know-how and knowledge right now that could save lives, and you're not willing to waive certain rights on a temporary basis, that means the entire structure and the entire system is wrong. So we'll fight for the waiver, but I think you're right. You know, the minute we can get global immunity, we're going to fight for the system to be totally upended because it's not working. The issue about the waiver was really also prompted by the fact that it's very difficult to use Doha. It's very difficult in practice to actually use the flexibilities. And this is very well articulated in a submission that the South African government made to the TRIPS Council in July already of last year, and said, we're telling you, these are the difficulties we're going to experience in the Global South with using these very flexibilities. So the flexibilities have not really worked. It was only really invoked, I think, in one case. In South Africa, even, for example, we've never had a compulsory license on a pharmaceutical product in 100 years, even at the height of our HIV/AIDS crisis. So this real unwillingness to take on systemic issues and systemic power. And if COVID, and the books will be written and the history will judge everybody quite harshly on this, is that if you don't do this in COVID, you're never going to do this. So, what is the point of Doha now, remains to be seen, because we literally, Feroz, begging drug companies now and governments to give us some parts of the supplies. And so that's the situation we're in, even though we've got this beautiful declaration that we all fought for, during the HIV/AIDS years. So yeah, that's my input.
Feroz, I think what Fatima is saying is absolutely accurate. If you just think back on the systemic issues, so the negotiations in Doha was exhaustive, and Fran knows this extensively well. But soon after the Doha Declaration was agreed to, after negotiations, most of the big countries then upended the agreements through bilateral agreements with countries. So, so you're seeing international instruments that can be enabling, but they are also disabled through other measures. So the waiver is there for, the fact that the scope of the waiver is for the duration of the pandemic or through negotiations for a period of time that can be determined by member states is indicative of the difficulty in getting this through the international system. And so it is partly ensuring that we can, in this crisis, get a waiver that's going to save lives. We made the case to the WTO that, despite the TRIPS flexibilities, despite the integration of the Doha waiver within TRIPS, that it is cumbersome, the case-by-case negotiation, product-by-product negotiation makes it very difficult for many countries to get the kind of licenses required to manufacture quickly and at scale, or to even to import from others that are given these licenses. And that's why the waiver is important, because the waiver takes away the burden of this cumbersome negotiations at a national level in a pandemic that touches every single country. So if you leave it up to the current TRIPS flexibilities, as being argued by some delegations from the EU, it just means that we are not going to achieve the goal of getting population immunity in the time that is required. And again, coming back to our own legislation, so we've got an IP policy in South Africa that essentially shaped the changes to our current patent laws, and if passed through Parliament, will actually, in the South African case, take away the cumbersome processes that will still exist under TRIPS, under the current framework. So that is important. But in this case, we need to look at the region, we need to look at the AU, we need to look at the broader developing South. And that is why the waiver is what we should be going for right now. Time is of the essence. People are dying, people are getting sick, economies are being destroyed. And actually, Fran made the point that it makes economic sense for many of the richer countries who are blocking the waiver at the moment to agree to the waiver if we want to get the global economy up on its feet again, to recover And that's an argument that we've also made at the level of the WTO.
Thanks, Zane. Fran?
So I agree with Fatima and Zane on what they said. From my side to add is that it's not about what is adequate at the current stage, because we can now just start to discuss what's all wrong with it, but we don't have time for that. So therefore I would go back to what Zane said, that we don't have time now to engage in the question of that what is missing in the TRIPS. And so the waiver is one mechanism that is there in the WTO that allows for a temporary exemption from obligation. And that's why South Africa and India choose to go for now, because time is of essence, to waive that part of obligation. And it's interesting that I have even read contributions from a previous appellate body judge who said that he doesn't see the exceptional circumstances. And if I may say that a waiver requires that South Africa and India proves that there are exceptional circumstances, and I'm not sure what more has to happen that makes it exceptional what we have at the moment. Yeah. So the exceptional circumstances are not related to the law. The exceptional circumstances are related to the situation we are in and why we motivate for having the obligations expensed for a moment. So therefore, it shows already the whole TRIPS saga and Doha waiver. It went on for years. If we are honest, it started 2003, 2001, actually, when you think about it. And the amendment was only in place in 2017. It was 16 years. That shows how negotiations at the WTO about issues like that, how long they actually take. So that is that time is not there. So that's why the waiver is for now the only option, despite what's actually wrong with the current law. That would be my my addition to that.
Thanks, Fran. Let me open it up for questions and conversation at this point. I think the way we'll do it is I'll give you two options, all the participants. One is to use the chat function. The other is to signal with your hand. If you signal with your hand, I will call upon you and you can then unmute. Okay. I hope that we do have a conversation. It's really, these are interesting and important issues. It's also very, very upsetting. So, anyone? I don't see hands yet. People are using the chat function. Togo asks about long-term solutions, which is really, I suppose, part of the conversation we were just having. Do we concentrate on the waiver now, which seems, for which there's a compelling case, but it did strike me in all three presentations that there were some fundamental questions about TRIPS and the way the trading system works that were also being raised, and those presumably can also be pursued. They should be part of the conversation going forward while we concentrate on the waiver. But Togo says, this is an excellent discussion. I have a question about long-term solutions for all three panelists. How would you restructure the current system, ensure that we can deal with the pandemic in a just and rights and a scientific way? So that's an important question. Someone, Colofelo, asks what options are available for South Africa under the Patents Act, Amendment Act. And Ingrid asks about the waiver. Is the waiver being discussed tomorrow? How many countries do we still need to vote in our favor? So our panelists perhaps can take those questions. People seem to be reluctant to put their hands up, which I don't really understand. But anyway, go ahead. Those are the three questions for Zane, Fatima, and Franziska. No response? Zane?
I'll take a quick stab. You know, as Togo mentions, the long-term systemic approach to getting us out of this quagmire of having IP issues impact on public health issues. You mentioned the Stiglitz quote right at the beginning of this. Is a discussion that we should have during this pandemic, but also afterwards. It is also linked to you know, what we've agreed to in the international community about fundamental reform of the financial architecture and locating the WTO within that. And so there are agreements, but nobody's taking the bit by the horn and engaging in what does this mean for the WTO? What does it mean for many of the other institutions? I think that what this pandemic brings to the fore is just, you know, we've had HIV. We've seen the impact of IP on lives and the struggles that Fatima and others have waged. We see on an ongoing basis the difficulties people who need to access, for example, cancer medication have because of the cost associated with pharmaceuticals, which is derived from IP legislation, which in its global framework. So this discussion is urgent. But at the moment, I think we need to focus on the waiver, and if we can get the waiver, and we you know, a question arose about which countries are going to be supporting us. You know, so 100 countries have indicated support from the floor, but in terms of co-sponsoring, there's only about 8 or 9 countries that's co-sponsoring at the moment. So South Africa and India were the major co-sponsors. And we need, you know, so generally you need a 2/3. If you can't get it on consensus, you need a 2/3 vote at the WTO. And unless there's enormous pressure from civil society globally to support the kind of government-to-government advocacy that's taking place, we may not get the kind of support that we need at the WTO. Ironically, I think Fatima pointed to this, is that when the supply crunch came in Europe last week, aside from the ban of vaccines manufactured in Europe, there were also considerations of invoking emergency use to do compulsory licensing in the EU. Using one of the articles in their founding legislation. So, you know, the deviation from IP regulations was a no-no when it was seen as a developing South issue. But the moment the supply crunch hit the North, suddenly they were more amenable to looking at how they could use their own domestic measures to invoke TRIPS-related flexibility-related legislation. So we need to have this discussion in the context of the right to health, using both international and domestic law, and take a much more considered and long-term approach to should the right to health and the measures that lead to healthy populations be bounded by the kind of IP rules that we do have. And that is the longer conversation. Lastly, what will our patent law, if amended, does? So we have measures under our current patent law that will allow for state use, will allow for emergency licensing, but it's very cumbersome at the moment. If amended, it actually makes us fully TRIPS compliable, and we can then, without having to go to court and the cost of a court process, the money and the time, move towards those measures much quicker. So, you know, that piece of legislation is ready to go to Parliament. Yeah.
I don't know if you saw Ingrid's question. If I can remember it, she asks about which countries are presumably in the global south are ready to manufacture if that option becomes available.
So, if I may, just that I don't know, but if I may be able to address a quick point of what Zane did, it's 123 countries, so it's 3/4 that would have to agree to it. But it's also very unlikely. Usually you would have to need consensus. So from a political point of view, there is a strong, let me say, very seldomly decisions are not made by consensus. And yes, there were a couple of waivers in the past where there was no consensus, and then they switched to a 3/4 majority. But that's generally not happening. So the practice is consensus, and that's why we have those trade wars or the blocking of the appellate body happening because of the consensus. Just for clarification, there was a question: what still needs to be done? Does South Africa still has to agree to it? Yes, they would have to. So in general, that waiver needs to go to the ministerial conference, which is only taking place every second year. In actual fact, it hasn't taken place since December 19. It was a 2.5 year break. It was supposed to happen in June 20 in Kazakhstan, but due to COVID moved and hasn't yet taken place. So what one can do, though, the General Council can also deal with this issue. There's a decision made that this is possible, and the General Council would meet every second month on daily issues. So the only way how to do it is at the General Council, and there South Africa would of course have to still agree, but it's very unlikely that they get consensus and that they actually get the majority, in my opinion. I would love that to happen, and I think that's why we're discussing the compulsory license in the first place, right? So to Kolo's question with regards to the options of the Patents Act and the amendment, whether it would be better, I don't think it would be better. What it is to make the options of the compulsory license process to make use of it better than they are now. They are not just problematic at TRIPS level, but also at the national level from South Africa. And I think the Patent Act as it stands is problematic to not actually be able to make use properly of it, of that compulsory license system. Plus, it's not TRIPS compliant on many levels. I'm not going to detail what there's not TRIPS compliant, but there are, and there are many things. So that's what I wanted to just add to that. About a future, how can we, create the future system? That's a hugely difficult question, because we can dream or we can be realistic. And realistic is that the IP lobby is big, and specifically in Western countries, and they that is their main issue. That is one of the biggest money-making industries that there is. So strong IP rights are very important to those countries, not because they gain something from it, but their stakeholders and the companies that actually make the money for their economies are those on IP. I mean, for the US, IP is long time far more important than normal goods and services as a focus point. So there are stakeholders who sit actually in the parliament who kind of interfere with decision making. Many examples that it goes back to the Hollywood industry, whatever, but it's also about IP. And that brings to that, in actual fact, if you would have to relook at the IP system as such. But you would also need those who protect it actually, who wish for very strong IP rights to actually do give it up. But why would you give it up when that is what you benefit from? And that's the problem. So the balance is always the question of the balance. What is the right balance for IP protection? And that maybe is important to remind ourselves that the balance between public interest and private interest in IP was always at the forefront, and that balance, in my opinion, is long time this. Yeah. So, and those who argue for strong IP rights, for them, they argue for that the balance is actually that. And so, where do you start? That is a political discussion and negotiation. So, in my opinion, that balance is in many instances skewed. Because the duration of protection is far too long for what you need in order to incentivize innovation. What was the original purpose of IP rights? But yeah, let's me stop and get over to Fatima, because otherwise I'm continuing here.
Thanks. So I'll try and answer some of the questions. The first is that our patent laws are TRIPS plus. It's a remnant from the apartheid days, and so the other reason why they need to be amended is that we just need to be TRIPS compliant. We don't need to be TRIPS plus compliant, and that's one of the problems, is that our law is actually excessive. It gives excessive protection to IP holders, and so it just doesn't make sense in a constitutional democracy, and amendments are now urgent. The second is that when you threaten a compulsory license against the pharmaceutical industry, we know this from our experience in HIV/AIDS, the industry does not want state measures or action or compulsory licensing or forced action. So what often happens is when you threaten that, you get voluntary action and you get multiple voluntary licenses, which in the end is what you want. You want to get medicines or you want to get vaccines. So in June of last year, for diagnostic testing for COVID-19, the Netherlands threatened Roche, a pharmaceutical company, on some of the testing liquids. And then, of course, what happened? Roche agreed. So sometimes the issue is not necessarily about actually getting a physical license in your hand and going through a whole legal process. It's the mere fact that you are threatening to take state action. That is what will happen. And we saw that last week. Both the US and the EU are willing to waive IP rights for domestic benefit. So the question now is the double standards in not extending that benefit to the rest of the world in the global south. So they basically said, we're in a wartime situation. We've got to scale up manufacturing capacity. We're going to do what is necessary and waive whatever rights. And the one thing that people often forget is that even with the waiver and even with compulsory licensing, you're not taking away the right of a pharmaceutical company to earn a reasonable return. Nobody's arguing for that. So you would still make some profit when you open up the technology and the know-how. And the issue is, whether that would be a reasonable profit, whether it would be a reasonable return. If you don't know how much it really costs them, and given that there's been significant public funding in all of this vaccine research, and given that a lot of public institutions have contributed towards the research, and that the pricing assumptions and data are being hidden and are secret and are sitting in NDAs, none of us really know what the company should actually be getting. Today, we found out that Uganda is paying more for something that we are paying for, and we paid more than something for a vaccine that the EU paid for. And like I said earlier, there's 5 different pricing lists, and now there seems to be, even more than 5 different pricing lists floating around. And I think this brings me to the point of, which is really the disheartening part, because we saw what the impact of this was in HIV/AIDS, right? And now we're seeing it with COVID. And I really do think history is going to judge these countries and these companies harshly because of the impact that this is having on our ability to rapidly scale up manufacturing capacity. Is that the reason this waiver is so threatening, and the reason that this waiver is being blocked, is because there is this genuine existential threat and concern by the industry, the pharmaceutical industry, that if you allow it and you open the door partially, what you are then doing is allowing a global order to not treat medicines as a commodity any longer. And this is the reason why we're in this position, because the trade system, the global order system, the WHO still treats medicines and medicine access as a commodity, as if we're dealing with a PlayStation or a bottle of perfume. And if you allow the waiver, and if you allow all of these different types of state action, you're fundamentally challenging that claim and that assertion that an industry that makes more profit than oil and gas, it makes more profit than the oil and gas industries, cannot continue with these kind of practices. And I think that is the reason, that we suspect that the waiver is considered to be so threatening to them, because it doesn't make sense, right? You're in a pandemic, nobody's experienced this, everybody's affected by it, the economy is hemorrhaging. Even the WHO, the DG has written a piece in the Financial Policy today saying, please share the vaccine know-how. We're in a crisis. You've got to spend billions to save trillions. Every study is showing the devastating impact not sharing the vaccine know-how is having. So let me, given that context, answer the question about how many companies could be lined up. MSF is working on addressing some of these manufacturing capacity myths. Like I said, it's not just for vaccines. You could also then manufacture diagnostics and other therapeutics, because we may very well get a treatment. We don't know. We thought it was remdesivir a few months ago. You could get a treatment next year, and then you wouldn't need a vaccine. We don't know, because the science is moving so fast. So the waiver would allow you to manufacture diagnostics. It would allow you to manufacture different types of oxygen technology. It's anything in the toolbox that could actually manage and treat and prevent COVID-19. And then there are some companies for some of the vaccine technologies, if you just want to focus on vaccines, that can start manufacturing. In fact, some of them now have last week and before, because the EU has had a crisis problem. And some can retrofit their plants. But if you know you're going to get permission and you do get the waiver and you know you're going to get a license, then you would invest in that retrofitting, in setting up the capacity so that you can do that. Because nobody in the industry is going to make a plant ready on the hope that you're going to get permission or a license. You would have to have that in black and white before you're actually going to invest that kind of money in that. So the regional supply issues, I think somebody made that point. I think it's really important, because this week we saw the president having to clarify or reverse, we think, a decision that said that only South African citizens would get access to a vaccine. And luckily he did. But the AU mechanism that I talked about earlier, because COVAX has failed us and because all these bilaterals have failed us, is actually the mechanism that is going to ensure supplies for the regions, first with healthcare workers for the whole of Africa, and then other more vulnerable populations. So if you're interested in the regional part of it, you really need to focus on AVAT. I think, Feroz, those are all the questions.
Okay, let me just thank all three of you for great presentations. I think we're just skirting the surface here. These are really, really important issues. And I, for one, would like to take you, all three of you, up on how we can take this conversation further. Thank you to all our participants. I'm sure that you enjoyed the presentations, and I hope that the next time more of you will be willing to put your hands up. Thanks very much.
Thank you.
Thank
Thanks,
you.
Feroz, for having us.
Thank you.
It's a pleasure.
Thank you, Feroz.
Thank you.
Thank you.